So we talked earlier about the potential complications of bariatric surgery, and I left aside nausea and vomiting. We're going to talk about that in detail now because it's so common. So again, we're focusing most of our attention on those of you that have had sleeve or bypass, but this talk really would apply no matter what bariatric operation you've had, with the exception of a gastric balloon. That's a different topic and not something that we address within these videos, so you'll have to look elsewhere if you've had a gastric balloon. So postoperative nausea is very, very common after bariatric surgery, and it's especially common after sleeve, and it's especially common if you're a woman. We don't really know why women have more nausea after surgery than men do, but it's very clear, having done this for 13 years now, that that's a fact. It just is a little tougher for women the first couple of days than it is for men. There's some very important psychology involved in dealing with postoperative nausea. And I think that preparation for going through this is very, very important. Nausea is a very powerful feeling, and it is one that your brain tries to protect you from. When you experience significant nausea, every part of your brain wants you not to have to do that again because it's so uncomfortable. And so you have to get out in front of this in order to deal with it really well after surgery. And again, I'm not saying all this to give the picture of everybody having horrible nausea. That's not true. But most people are going to have some nausea, and how you react to it is extremely important. So you need to understand that this nausea is a result of the restriction that comes with bariatric surgery. All operations that we're doing are restrictive, meaning they're making your stomach smaller so that you eat less. And your body feels that. And one of the reactions initially is nausea. And you have to tell yourself this over and over and over again. There's not something in your stomach that if you vomit it up, you will feel better, like if you have a food poisoning, for instance. This is different. You'll sometimes have patients that do a lot of dry heaving and gagging, and it's just not going to make you feel better. And unfortunately, it really can make you feel worse. So I'm a big believer in breathing techniques, meditation, anything that brings a mindfulness to dealing with this nausea, so that when you begin to experience this nausea after eating or drinking following your bariatric procedure, you're able to fall back on these tools, close your eyes, take 3 nice big deep breaths, tell yourself everything is okay. These kinds of techniques are very, very important because they help diminish anxiety. Anxiety is going to make your nausea worse. If you don't hear anything else from this talk, make sure that you hear that. Anxiety is going to make your nausea worse. You're going to be okay. It's not going to be like this forever. And you need to remind yourself of that, because these are the thoughts that sometimes creep into your head. Oh my gosh, what have I done? This is terrible. I'm never going to be able to eat again. All of that is untrue, okay? Now, of course, we're talking about just strictly nausea. When your nausea is combined with significant abdominal pain and or fever, there could be a different issue, and you'll need to contact your physician about that. But what we're talking about now is you're doing fine, your abdomen is getting better, it doesn't hurt like it did, you're not running a fever, You just get nauseated after you eat. So that's what we're talking about, and it's important that you understand that distinction. Now, there's a couple time frames in your postoperative period where we have to view nausea and vomiting a little bit different. You can develop what's called a stricture, a narrowing with either sleeve or bypass. With sleeve, this is really uncommon. It really should not happen more than 1% of the time, and even 1% is a little bit high. Your doctor will often describe your stomach after a sleeve as looking like a banana. And if you're going to develop a narrowing, it occurs in that curvy part of the banana. Usually, it doesn't happen right away. You'll begin to experience symptoms from this about 3 to 4 weeks out from surgery. So if you're doing fine, everything's moving along great, and you're 3.5 weeks in, and all of a sudden you're having trouble keeping down things that you were keeping down before, you might have a stricture and you should call your doctor and talk about it. With bypass, there's a new connection made between your stomach and your small intestine, and this can be done a number of different ways, but regardless of how it's done, you can developing a narrowing of that connection. And again, that usually happens 3, 4, maybe 5 weeks out from surgery. So again, it would be a situation where you're going through your diet progression, everything is going okay, and then over a 3 to 4 day period, you start to not be able to keep the same things down. If that happens, contact your surgeon and talk to them about it to make sure that you haven't developed a stricture. The other thing that's important is be open and honest if you're struggling with the emotional side of advancing your diet after bariatric surgery, because those struggles can be real, and if you don't address them, they will just get worse. You'll build a negative feedback loop where just the very thought of eating can cause you to be nauseated, and you want to avoid getting into that loop. So just acknowledge that nausea can be an issue after surgery. It's okay. It's not a sign of trouble. It's going to get better. And keep your anxiety level low by utilizing things like meditation, breathing methods, writing down positive affirmations that you can read, when you get those feelings. And all of that can help. And just be very honest and open with your physician. And if they are an experienced bariatric surgeon, they're going to have dealt with this many times before, and they can help you. So you'll get better. It's going to be okay.